Let's see. How do I know if I qualify or if I need Medicare?
Oh, wow. So that is, to me, one of the shocking things that people who are becoming Medicare eligible, whether that's for a few different reasons, we'll go over in a second, that just aren't aware of it. And so we could give you a list a mile long of reasons and opportunities, but I'm going to give you the most common. So most people are going to qualify for Medicare when they're turning 65. That's going to be the vast majority of people. When they turn 65, they're going to be eligible for Medicare. The other one is if they're on Social Security disability for 24 consecutive months. Okay, and so keep in mind that you might be a 40-year-old. You might be a 50-year-old. You might be a 55 or 60-year-old and on Social Security disability for 2 years. Now you're going on to Medicare automatically. That's just going to happen.
Yep.
Another one to keep in mind, if you've applied for Social Security disability and been turned down, and then let's say you go get an attorney or you apply again and you get approved, they're going to backdate that approval back to when you first applied. And so I've had clients that walk in the door and say, hey, listen, for some reason I got this Medicare card in the mail. Like, when did you apply for Social Security? Well, it's been a couple years ago. Ta-da, that's why you got it. So that's the one. But the most common is when you're turning 65. Now, keep in mind, if you're still working, you're still in an employer-sponsored plan with at least 20 or more employees on that group plan, and it's considered creditable by the government. That means it's at least as good as what Medicare would offer. Then you don't have to do anything. So we have a bunch of clients, and one of the big employers in our area is a government site. Right? It's a private contractor, but it's a government site. And tons of our clients are eligible for a group employer plan, and they continue to work to 66, 67, or even sometimes 70 or plus.
Yep.
They stay on that employer plan. They never sign up for Medicare during that period of time, staying on their group plan. No penalty, no problem. They can apply for Medicare as soon as they decide when they're going to retire, and that's okay. Now, if you're on a small employer plan that doesn't offer health insurance, or it's 19 or less employees, then you got to sign up for Medicare. You have to do it. And there'll be a penalty. And unfortunately, we have people we meet once in a while that didn't do it, and that penalty is for life.
Yeah.
And it stinks because it's not a small amount of money. We were talking about our meeting today. One of our agents, I think he said, someone who hasn't had a Medicare prescription drug coverage for 15 years.
Yep.
That penalty is about $75 a month for the rest of that person's life if they ever sign up for a prescription drug plan.
Yep. They had no idea.
Yeah.
They just thought, I'm healthy, I don't take drugs, why would I need this? And then
They never talked to a broker.
Never talked to a broker.
For advice.
Yep, exactly right.